Okay, we are starting recording now. So I definitely again want to welcome our guests. And Stephanie, we will turn it over to you.
Okay, thanks, Jamie. So first off, I'll introduce myself. I am Stephanie George Bever. I'm the program coordinator for the Healthy Aging program, which is at the Utah Department of Health and Human Services. And really quick, my program, essentially, we manage a couple of national grants for evidence-based programs for falls and for arthritis and chronic disease self-management education programs. And most of our programs are targeted toward older adults, like I said, adults with arthritis, chronic conditions, people with low mobility. And Marianne is going to go over in more detail, at least the falls prevention suite of programs that are offered in Utah. But just know that there are more than are going to be covered today, even more physical activity programs that could be a resource still to all of you. But so what I will cover is more an overview of some of the data related to falls and EMS, as well as this NCOA, so the National Council on Aging 6 steps to prevent a fall, and quickly just high level some of the resources that we have here. So Mary Ann can get more into the details of the programs we specifically offer. Okay, so first off with the data. So falls are the second leading cause of traumatic brain injuries and spinal cord injuries here in Utah. And 1 out of every 5 falls causes a serious injury. Specifically for those 65 and older, they are the #1 cause of non-fatal injury-related hospital admissions. That's a mouthful, but just the #1 cause of hospital admissions for injuries, essentially. And 70% of those who end up in the hospital are going to end up in residential care or rehabilitation facility. So thinking about it, like, this is a major event in people's lives who are older, they have a fall, and now only 30% of them are able to return home without a lot more work and support. And 80% of falls lead to hip fractures. Nationally, there are over 36,000 deaths and 3 million visits, and it adds up to $50 billion in medical costs. So this is a huge, huge area. Specifically, again, in Utah, that the numbers shake out to be around 65,000 emergency department visits a year and almost 6,000 hospitalizations. And again, on average, it's about $54,000 in costs for an average of a four-day stay at the hospital when people have a fall. Additionally, so thinking more about falls and EMS, sorry, I don't know why this slide, okay. There we go. I had to pull some of this information. I saw a great presentation by Andrea Vastus. She is the Senior Director of Public Education at the National Fire Protection Association. She did a great presentation at a conference I went to recently about the connection between fire and EMS, but this is where I'm getting this next set of data. I apologize, I don't know specifically these numbers for Utah, but that's something we can look into more. But again, among people 65 and older, falls accounts for almost or about 17% of 911 calls, and about 1 in 5, so 21% of emergency 911 calls actually don't result in a transport to a hospital. They're what, I don't know the terminology that you all use, but they're lift assist calls often. So nearly 50% of lift assist calls result in a second lift assist call within 2 weeks. So it's just repeated use among the same people. And because of that, it if you think about it, it can have a significant financial consequence, as well as just decreasing the availability of EMS to respond to more urgent needs. And so when individuals are using EMS for fall or assistance getting up to a more mobile position, but not requiring transport to medical care, that's the lift assist. And these lift assist calls are actually associated with increased morbidity and mortality within 2 weeks of the lift assist call. And so because of that, we need to consider these calls as a sentinel event, and it's an opportunity for additional assessment and intervention to prevent further injury or medical deterioration or disability. And as you all are trusted sources of information, you can play an important role in engaging and educating older adults on the services available in their community before or after a fall. So again, as I mentioned, these lift assist calls, they're costly and they're diverting care from other acute needs that might need immediate transport to care. And since you all can see this person's life, you're potentially there in their homes, you're seeing more of what the environment is like. Again, it's a great opportunity and hopefully a teachable moment for people. It's not always, you need to know when to time these teachable moments, but this can be a wake-up call for some adults that might not think they are prone to falls. So I'm going to share one of the National Council on Aging's resources that is included in that toolkit that Jamie mentioned earlier on. And so this PowerPoint, they created a couple of slide decks that can be shared in a waiting room, at a hospital kiosk media station, at senior centers, essentially anywhere there's a screen or a monitor. They have outlined 6 steps to prevent a fall. And even if you don't have a monitor or you're not just sharing this resource in a waiting room, I just wanted to share it with all of you because you do have the opportunity to connect one-on-one with people, and you should be aware of these steps and able to have some of these conversations with them and guide them to additional information or resources. So these are their slides. And again, they have set up their resources. So if you do choose to use them, it can be run like automatically, the slides will advance forward. I chose the shorter of their slide decks. They actually have a longer one that gives more details on each of the steps. But just due to time, I chose the shorter option. So first off, they just give quick data about basically every 11 seconds, there's an older adult that is seen in an emergency department because of a fall injury. And again, something I didn't mention earlier, I do want to, I hear the whole, it feels like it's falls reduction, not falls prevention. And prevention is always hard because you can't actually like count who would have fallen in the first place, but falls are preventable. And that's the message that many older adults need to hear. There are steps that can be taken to reduce their risk, and so that they can hopefully not live in fear of getting out, doing the things that they want to do. So here are the steps. Number 1 is to find a good balance and exercise program. And some of the hallmarks of what is really helpful is finding programs that build balance, strength, and flexibility. And their call to action is to contact your local AAA for referrals to find a program. Again, Marianne's going to show you, we do have a program locator in Utah where people can find falls prevention programs near them. So second is to talk to a healthcare provider. And I will share, there is a falls assessment that I'll share again that through the National Council on Aging, but really getting that conversation with healthcare providers, and they can help identify maybe some of the areas in their realm of expertise that can help reduce falls. So third is to review your medications with the doctor or pharmacist. Especially as people are getting older, they might be taking more and more medications, and maybe it's been a while since they've been reviewed, and the interactions or just a specific medication can be a risk. The side effects can be a risk of falling. So it's important to make sure that's being looked at, and all of them are being looked at together and not just like one with one provider. Fourth is to get your vision and hearing checked annually and update your eyeglasses. Again, that's something people can put off and not realize that things are getting worse, and it is a contributor to the risk of falls. Fifth is to keep the home safe. Some people need education on what changes they need to make in order to reduce those hazards in their homes that might cause them to fall. Even pets, unfortunately, beloved pets can be part of this. And just, there are options to figure out how to make the home safe while still making it a home that they enjoy. And 6 is to involve family members. Make sure conversations are happening, that your concerns and fears about falling are being shared. Maybe they need help setting up appointments. Maybe they need help finding resources. Maybe they need an advocate with them when they go to the doctor, or they can't remember all the medications they're taking. These conversations need to be happening, and happening more than once. So this is, again, ncoa.org/falls, where you can find many more of these slides and many more of the resources. But specifically, there is the Falls Free Initiative. You can seriously just Google National Council on Aging or just Falls Free Initiative, and it will pull up and it will link you to their Falls Free National Action Plan. There's a coalition, as we're right now in the middle of Falls Prevention Awareness Week. That toolkit is so great. It has talking points, it has social media graphics, news, how to interact with the media, and even if you don't have time just to do it this week, it can be done all month long or in the future. It doesn't just have to be Falls Prevention Awareness Week. And then the Falls Free Checkup. You can have hard copies of the questions people can go through to assess, like, okay, if they say yes so many times, they're at a risk. Or this link will go to the online version and will automatically tell people or show people what the next steps are, or what they need to be doing. And since we do have falls prevention programs, we just want to make sure anytime the National Council on Aging's like toolkits are being used, we can just insert our program locator. It's just a website link, or we can even have a URL routing to it, that is included in those resources. But again, I'm Stephanie George Bever. My contact information is sgeorge@utah.gov. I apologize, that's actually still my program manager's number, so I'll have to share with you the correct number. And there's some data on our classes, but I'll turn it over to Marianne to go into more detail.
All right, thanks, Stephanie. Wait 1 second. All right, so I'm Marianne Christensen, and I work for Salt Lake County Aging and Adult Services, and I'm the Health Promotion Manager. And we're going to talk about specific community evidence-based fall prevention programs that we have available in Utah. Hang on. All right, so Stephanie did a great job of sharing the stats of the detrimental effects of falls for older adults, which I think we're all really well aware of. But I'd like to remind us of this, what we call the cycle of consequences, or it can be a vicious cycle that often older adults fall into or get trapped in. And once they've had a fall, or maybe they are afraid of falling. So you start at the top and someone's had a fall, or they have a fear of falling, so they lose their confidence. And as a result, as we move around, they often restrict their activity, which reduces their mobility and also leads to isolation. And then they have a loss of physical fitness and their function declines, which then makes them even a higher risk for falling, and it just kind of goes around and around. So I'm going to share today some community resources that are aimed to help older adults get out of this cycle and hopefully regain their confidence and physical strength and knowledge about how they can prevent falls. So as we mentioned, there are evidence-based programs that are offered by area agencies on aging. There are actually 12 area agencies on aging in Utah. We are funded by Older Americans Act funding, which comes from the federal government, and then it comes through the Utah Department of Health and Human Services. And we provide different community and home-based services. But today I'm going to focus on specific fall prevention classes. So I specifically am part of the health promotion team with Salt Lake County, which we actually offer 12 different evidence-based programs for older adults. But I'm going to focus specifically today on the fall prevention ones, but the rest of the ones that we offer are listed here on this slide. So the fall prevention classes that we offer that have been researched, then proven to actually reduce the risk of falls in older adults include stepping up your nutrition, Tai Chi for arthritis and fall prevention, and enhanced fitness. So we're going to talk about each one of these individually. So the first one is Stepping On. Stepping On was originally developed in Australia. It is now overseen by the Wisconsin Institute of Healthy Aging. And the research has found that participation in this program can reduce falls up to 31% in older adults. This is a 7-week class, and they address the multi-facets that lead to falls for older adults. And so the areas in which they focus on are first, strength and balance exercises. So a physical therapist comes to 3 of the 7 sessions, and they teach the participants specific strength and balance exercises that they can do at home to help reduce their risk of falls. And then we talk about medications and how that can relate to falls. And we have a guest pharmacist come 1 week and talk about that. And they're able to answer questions for people. And then we talk about vision, and that week we have an eye doctor come, or an eye specialist, and talk about how vision affects falls. Like Stephanie mentioned, if people need the importance of getting their eyes checked regularly so that they can reduce their falls. Then we also talk about home modifications, things they can do in their home, grab bars, night lights, those kind of things to help reduce that risk. We talk about safe footwear. We also talk about community safety, like how to get around in the community safely, like walking up and down curbs, getting on and off buses. If you go out to eat and the parking lot's not well lit, some tricks about ways you can reduce your risk when you're out in the community. And then we also talk about the importance of sleep. So that is the Stepping On program. And here's some just basic outcomes that we've seen in the Stepping On classes here in Utah. And these are some great outcomes. I mean, people are more committed to doing the exercises they learn in class. They've talked to their doctor about their fall or their fear of falling. They're more willing to get their vision checked. They say that this program has reduced their fear of falling. It's a really powerful program to kind of break that cycle I mentioned earlier, just to give them confidence to keep being involved in the community and the things which they enjoy, but to do it safely. And also to teach them exercises to help improve their strength and their balance. The next program is called Stepping Up Your Nutrition. This is just a one-time class. It's 2.5 hours long. And the premise of this class is the importance of nutrition and how that can affect your fall risk. We talk a lot about how it's a natural progression to lose muscle mass as we get older. So this class focuses on the importance of getting good sources of protein in your diet and a well-rounded diet so that you can maximize your muscle mass for as long as possible and reduce your risk of falling. So it's just focuses specifically on nutrition, how it relates to falls. Then we have Enhanced Fitness. Enhanced Fitness was developed in Washington, the state of Washington, through an organization called Sound Generations in partnership with the University of Washington. This is an overall group exercise program for older adults. It's taught 3 times a week for 1 hour, and it's an ongoing program. So they do 20 minutes of cardio, then they do some strength training, and they do specific exercises for both flexibility and balance. All the instructors have a national certification in exercise, and then they're trained specifically in enhanced fitness. And here's some outcomes that we have seen at Salt Lake County Aging and Adult Services. So part of the program is that we do some fitness testing on the participants. So we do the Rickley and Jones senior fitness testing. We do the timed up and go, the sit to stand, and the arm curls test. We do it when they start the program and after 4 months, and then once a year after that. And these are some of the results that we've seen. The people who have participated regularly in enhanced fitness have improved or maintained their leg strength, their upper body strength, and maintained or improved their balance. And these are really great outcomes because, as we know, as we get older, we slowly lose that strength. And so even just helping someone maintain what they already have is a big win. So it's a really great program for fall prevention. So that's enhanced fitness. Then we have Tai Chi for arthritis and fall prevention. We teach a form from Dr. Paul Lamb. This is a little bit newer program for us. We've only done it for a couple of years, but the research for this program has proven to reduce the risk of falls by 70%. So Tai Chi has a lot of fall prevention research behind it. But at this class, the class that we teach is a 16-session class, and each class has some gentle Qigong warm-ups. They do breathing exercises and then Tai Chi movements. They learn 41 different forms. We have found that people with mobility issues, or who don't feel like they can do the more traditional exercises that we see in enhanced fitness classes, are more willing to try Tai Chi. So this has been a good complement for the physical activity classes that we offer, because different people enjoy different forms of exercise. So this is all well and great, and there's a lot of different programs. And I saw this, a physical therapist shared this at a conference a few years ago, and I really liked it, because sometimes you're like, oh, that's great, but how do I know where to refer people to? That's a lot of different options. And so I like this little pyramid of fall prevention programs that the physical therapist shared with me. And so if you start at the bottom, this is for more traditional and older adult exercisers, people who are cognitively intact and they have few balance problems. They might be really involved doing things that they enjoy, like golf, ping pong, pickleball, dance, exercise classes. And then as you move up the pyramid, the next level is for people who are still cognitively intact and they have few balance problems. They might be a good candidate for Tai Chi, enhanced fitness, or Silver Sneakers or Silver and Fit. Those are programs that are offered through insurance companies where they can pay gym memberships for older adults. And then as we move up to the next level, Stepping On is developed for people who are still cognitively intact, but who maybe have a history of falls or have a fear of falling, and they have some mild to moderate balance problems. And then as you move up to the top level, Physical Therapy is based more for people who need one-on-one therapy. They might have moderate to severe balance problems, maybe homebound, and may have some cognitive impairment. So I thought that was a good just visual to know where maybe these classes fall among each other. And then I also want to just briefly share, there are a few other programs that we offer that have a fall prevention component, even though they weren't specifically geared for fall prevention. So 2 other exercise programs that we offer are the Arthritis Foundation Exercise Program and Walk with Ease. Both of these programs are physical activity programs for older adults. And as we know, the more active an older adult is, the less risk they have for falling. So any type of physical activity is going to help with their fall risk. And so those are some really great exercise programs for older adults to get involved in. We also teach the NCOA, the National Council on Aging, developed an Aging Mastery Program. This is a 10-week class where each week we talk about a different topic to help older adults kind of master aging. There are topics like community engagement, healthy relationships, financial management, sleep. But we do focus one of our weeks on fall prevention. So they get a really in-depth lesson on one of those 10 weeks around fall prevention. And the same with the self-management, chronic disease self-management programs. We do living well with chronic conditions, living well with diabetes, and living well with chronic pain, which these also are not developed specifically for fall prevention, but there is a component. We talk 1 week. These are 6-week classes, and we talk 1 week about one portion of 1 week about fall prevention. So those are some other programs that we offer that do have a fall prevention component. And so the magic question is, great, how do I get people into these programs? So we do have a statewide database, and the website is healthyaging.utah.gov. We can add that to the chat, but it's a great website with lots of information for older adults and also for providers. So if you want to refer someone to one of these classes or find one for yourself, you simply click on the purple box that says find a workshop, and then this other box will pop up that's here to the right, which is the workshop search. I have a hard time saying that. Where you can type in your zip code if you want an in-person or a virtual class and what program you're looking for. And then you simply just click on the green register button, and it's a simple way for you to register yourself, or if you're helping a patient or a client or someone you're working with, you can also easily refer them to classes as well. And then I just wanted to share really briefly, this is a picture of Stephanie, who recently took a stepping on class, and it really empowered her and changed her life. And she wrote this amazing letter. I'm just going to summarize it. She is originally from Japan, and she's visited Japan several times since living in the United States. But about 5 years ago, she visited Japan, and while she was there, she had a fall, and it really broke her confidence. And she didn't think she was able to travel again because she was so worried about falling when she was traveling in another country. But her daughter and her grandchildren wanted to go to Japan, and they wanted her to come with them. And she was so nervous about it. But she signed up for the stepping on class, and it really boosted her confidence. And she ended up going on the trip, and she didn't have any problems, and she was able to keep up with her family. And it just, she said, changed her life so much. And she just had so much confidence after taking the stepping on class. So I just wanted to share that. And then that's my contact information. If anyone has any questions, I'm assuming we'll do questions at the end, but I'll turn the time to Ruth.
Marianne, we're actually going to open it up for you and Stephanie right now, since Ruth is going to do more of the medical side of it. So there was a question in the chat, and I know Stephanie kind of reached out a little bit, but it's getting the information out to the elderly in Judy's community. For the seniors, they have the dinner once a month. They have entertainment, but asking about a stepping on program. Do we know how she can do that in that community, in the senior center? And then what resources are available to actually do the class?
So we do have partners throughout the state, like Marianne and Salt Lake County Active Aging Services, where they're implementing these programs, and Utah County Health Department is one of those agencies implementing Stepping On. So I can connect you, Judy, with the contact person there, and they could offer the class, or if you're interested in doing them more regularly, we can get more people trained in your organization, and they could start doing them as well.
Yeah, and I could add, if you are in Salt Lake County and you have a group of people, we generally like to have at least 10 people in a group. Would be happy to come to your organization and teach it for you if you have enough people interested.
And then I just had a question for both of you as well. I know Ruth and I were part of the Falls Prevention Coalition, but as other people, either from different hospitals or agencies, how is it good? Because I know this is one of the initiatives to partner. Part of our job, obviously, is education, especially if our groups are seeing patients come in for falls and discharging them. We want to be able to give them this education and what resources are available to them. So what do you guys feel is kind of that best way to maybe partner with you? Is it getting flyers in the emergency department, or what do you guys feel like we can collaborate better on this?
Not sure who's going first, but okay, we do have a prescription pad of sorts, which lists out all the programs Marianne mentioned. The tricky thing is sometimes there are additional programs that AAAs might implement that aren't listed on it, but it does have Tai Chi, Stepping On, Enhanced Fitness, chronic disease self-management programs. And there's a phone number to call. Our health resource center can help register people for these programs, or the link to the workshop locator. That's probably just the easiest thing. We do have these marketing materials that could be shared that list the programs and where you go to sign up for the programs. Is there anything else you'd add to that, Marianne?
That's all I was going to say. The more you can get people to actually register by going to that website yourself or helping them get to that website, the better. I found that if you just hand them a brochure and say, hey, you should check out a community class, they probably won't, most of them. But the more we can actually take the step and get them registered, then those of us who are implementing the program reach out to them and remind them and can get them hopefully to get to the class. But yeah.
Yeah, and just really quick, our materials are shared on our website, but I also have some hard copies that I can get to people as well.
Thank you. And then opening up, does anybody else have any questions for Stephanie or Marianne before we turn it over to Ruth? Thank you, Stephanie, for putting that link in there. I know that I need to work on getting that prescription pad so Ruth and I can have it. Perfect. So Ruth, we will turn it over to you. And if anybody does think of any questions, please both feel free to get them in the chat. And we will again open it up for questions at the end.
Well, I'm actually really excited to go last because they have touched on some really important points that I'm going to add on to. My name's Ruth Braga. I'm the other injury and prevention coordinator with Jamie. That's how I feel. But no, she's awesome, and we have a great time together. We're both sporting our vests today. We didn't even plan it. Look at that. So I am going to talk to you a little bit about the medical side and the impact. This is just from University of Utah's perspective. Over the course of from 2019 to 2023, this is the some of the data that came into our hospital. 3,058 falls. And I was blown away as I'm dragging my little cursor down my Excel sheet and watching this 14,669 total days stayed in the hospital, making that a 4.8 day average length of stay, average age 64, and 3% of these patients didn't make it out of the hospital. And that's just at the time of hospitalization. So that's not looking at the mortality of those that were discharged and then passed away. So obviously this is, like Marianne and Stephanie have said, this has a huge impact on our state. And many of you that are on here, these are patients of yours as providers. You brought them to us in a chopper, an ambulance. They were attending one of your classes. These are people that are around you and in your community that were brought to us that have been impacted. The average age of 64, it doesn't get to be too surprising, but I was quite surprised because we hear a lot about older adults, right? And this is an AARP thing, and we get into this aging safely and older driver, all of that stuff. But what I really want to talk about today is what age are you at when you are in the workforce? And that's getting down into these, that 26 to 35 up to the 56 to 65. And that's essentially you guys. And I really especially want to focus on our healthcare providers and those that work in healthcare. And if you are working for a health department, this is going to include you. I know you're not necessarily EMS or RNs, So they'll be deterred by that, but I'm hoping that the resources, and I cannot see my polls anymore, Jamie. It disappeared. But if you're on here and you're, oh, look at that. And I don't even know how many
That's your-
EMS we
I'll
have.
get it.
Yeah, we may not have any EMS, but I'll give you just a little bit of a reason why I'm asking this, because in going out and talking to the different fire departments, I was very surprised to hear from them how many times they were getting called out. And just looking at our numbers, and was it lift and assist, Stephanie, that you said that those calls are
Yeah,
called?
just lift assist.
Lift assist.
Mhm.
We're tying up EMS. One of the firefighters in American Fork told me that one of the nursing homes just has a policy that if anybody falls, they immediately call 911. You know, it doesn't matter how mild it is or anything. It's just if you fall, it's 911. And we know, of course, we have a lot of those patients that come in from those facilities. And that's getting into, do we need to look at staffing? Are there other risks and hazards? And that's a topic for a whole other discussion. But just these few that have come on, you can see we've got multiple times a day per shift, once during shift and 2 times over the last 3 rounds. I'm not seeing anybody saying that they weren't called at all. So that just tells you this is probably a good reflection of most of our EMS programs. See if I can get out of that now. Okay. I actually found this painting. I had no idea this existed, but this is Dr. Relaxing with Tea by Norman Rockwell, 1958. And this looks like a very calm, chill healthcare provider. I don't know when the last time is that you saw anybody that worked in anything close to healthcare that looked like this. I have not. So I want to kind of shift the discussion a little bit to talk about not just our patients, but about you and how you are caring for yourself and preventing falls for you on the job or at home. But because of what you do, you run that higher risk. Oh, it's there somewhere. Sorry, I lost my mouse. Okay. EMS. Now we're talking about you as the provider. More than 22,000 of our emergency responders visited emergency departments each year. And this is back in 2017. Same thing with the nursing data that I'm going to show you. A lot of it that started up with 2019 and later, the data has shifted to be, you can imagine, exposure to harmful substances with COVID coming in. And so it's a little bit difficult to determine how skewed that is. But we've got slips, trips, and falls, 4,000 injured workers per year. Now that poll that I showed you at the beginning, that chart, it did not differentiate in all those 3,058 falls that came in. How many of those were you as providers that were coming into our ER? There's other things out there that are causing injury, of course. Sadly, violence and assaults, that has really grown, especially since COVID. And then nursing is the same thing. Floors, walkways, and ground surfaces represented the next most common source of injury. So we're seeing this blue color in here as the amount of falls, slips, and trips. And just like all of our other data, the older that your nurse is, this fall amount increases for them. Overexertion and bodily reactions, we've got those turns and twists. But again, falls, trips, slips, and trips, those are those are a significant amount to our nursing population. I'm going to point out again, violence is increasing amongst our healthcare staff. So that's another thing that we really want to pay attention to protect our staff and prevent anything from happening to them. So this is the next question I have for you. How often do you have assistance when lifting someone or assisting with a transfer at work? And this is something everybody should be able to answer. Even if you don't lift, if you could check that off for me, that's not part of your role. And think to yourself, how many times did you maybe lift somebody or assist them with a transfer because there was no one else around? Or you're in a hurry and you think, well, I have to just get this, I got to get this patient taken care of, or I've got to get this done. And so I'm just going to do it myself and I'm going to wing it and hope that I don't biff it. Okay, so this is good. Always, almost always. We do have a couple of sometimes and an NA, do not lift. Yeah, any more participants? I won't ask you why, don't worry. But I do know that that's a reason. There's a lot of times you just simply do not have other people to help you. All right. So that's another big contributing factor, again, back to staffing and what we see with our EMS getting called into nursing homes and other facilities. Our nurses and other healthcare workers don't have the people to help them. We're getting to that time of year where we're going to be paying a lot of attention to what's going on up on the Hill. And I did a little bit of research into this to see if there's any fall prevention legislation going on in Utah. I was shocked to find 16 states have patient safe handling laws. And this gives you, it basically can range from anything with a guideline for patient to caregiver lift ratios, weight limits, reporting protection, so if you fall, you can't be reprimanded or anything like that. And there's that 5% of the falls seen at the U took place in a nursing home or residential facility. My husband is working with an agency here in the state of Utah that's challenging a 2-to-1 ratio for a lift, that they're saying that that's not necessary. So when we have decisions like that being made, that's worth paying attention to, because if you're telling me that I shouldn't need 2 people to lift or transfer somebody, that's potentially going to increase my risk of a fall as a healthcare provider. So that's where we want to get involved and advocate for one another in our legislation and in these bills that get passed. None of our surrounding states are part of this 16. I think California, Washington, and Oregon were our closest. So I don't believe I don't know how much these are even on the radar of our legislators. But we may want to look at that, and it's very important to advocate for one another. Federal initiatives related to EMS are ongoing. Know what's happening in your state, what's happening to protect our first responders as far as injury protection. And the National Institute for Occupational Safety and Health, they're saying they consider falls amongst healthcare workers as one of their top research priorities. So we want to hold them to that. And we want to make sure that we pay attention and we nag and we call our legislator, our representative, and make sure that they really are being mindful of these things that impact our workforce. Just for funsies, what's real? I always love to go look up stock photos on online. I've never, ever seen a doctor relaxing after complex surgery in a hospital that looks like this. It goes back to the whole my friends think that I do, what I actually do. This was my world. I was surrounded daily with major, massive trip hazards. You've got slips, trips, electricity, while you're stepping into a wet puddle, there's a lot of hazards that are in the operating room. And this is the reality for a lot of our providers. Yes, this is an issue. I am not anti-Crocs. Please do not anybody like message me with hate. But I think about the things that healthcare providers wear sometimes. I swear if I see these, I'm going to kick the hill out from somebody. But we have to be very mindful. Is there a policy about our uniform? Is anybody taking into account that some of the shoes that are stylish may not be the safest? And yes, this is a little exaggeration. This is more the reality, isn't it? We've got a lot of hazards going on here, and things that can be tripped on. I see a lot of bending, a lot that's going to have an impact on these guys and these women later on in life. So we've got to remember that what we're presented with as far as media and things like that, Grey's Anatomy, none of it's real. And we have to continue to share what is our reality so that people know we need to take better care of our providers. I'm just really curious on this one. Have you ever fallen at work and did you report it? Because this is the other issue. How many times do people just biff it and think, you know, oh, I'm just going to go home and I come back the next day. Will that poll work, Jamie? They fall down and they think, oh, it's no big deal, or oh, this is just what I signed up for. This is a risk of my job. It's what I do. And didn't realize. That's okay. Go ahead and skip that. I just looked at my time. So, and then finally, what about you? So we go from the 1958 Norman Rockwell doctor sipping tea. This is a photo that I remember seeing. This is back in 2015. A physician who had just lost a 19-year-old patient and is showing the very raw reality of what he's feeling after. And the fact of the matter is that after this long, hard cry, he goes back in and continues caring for others. And that's what so many of us do. So that takes quite a toll. And I just want to point out that it's Falls Prevention Month, but it is also Suicide Awareness Month. And the 17th was National Physician Suicide Awareness Day. There's a lot of organizations that have created support, and that includes all of you, whether you work in a health department, if you're an affiliate, if you're a non-affiliate, you're in Montana, you can utilize the Safe UT Frontline, Code Green campaign for EMS. 988 is, of course, the crisis line. But these things add up. And when we're taking care of people and it's taking a toll on our physical health, and we're bringing these patients in one right after another, even though we're frustrated and see that there's things that could be done, this can take an impact on you. So I just really want to finish that off by saying, please take care of yourself. And remember, this is not all just for your patients, but it's for you. So if you have any questions, please let me know. Always happy to come out and help and talk to your providers.
Awesome. Thank you, Ruth. Does anybody have any questions for Ruth? Ruth, I'm waiting that uncomfortable 8 seconds. Ruth and I learned in a committee, it takes adult 8 seconds to process the question you ask and actually formulate the question they want to say. So I'm okay with the uncomfortable silence.
I just wanted to find a picture of Big Hero 6 giving everybody a hug, because that's kind of how I picture this aspect of the presentation. Is just next time you see your doctor or a first responder, nurse, give them a hug. It's what they need.
And I appreciate the overview too of it's not just taking care of your patients and preventing falls, it's preventing, an injury to yourself while you're working. or while you're at home, so you can continue working and caring for these patients. And again, we, like I said, as healthcare providers, it's our job to educate. And just know that it kind of hit me when we did a case review the other day that it's not just our older adults who have a fear of falling for a second time. We had a trauma patient who had a significant fall with significant injury and said that that was the one thing that he feared the most, is falling again. And so us being able to educate and provide the resources to hopefully prevent future falls, or maybe if you have somebody that didn't have a large injury, or just any older adults, if they're not even coming in with a fall injury, educating them to do that primary prevention to prevent falls in the first place, or asking that question, have you fallen at home? Are there any trip hazards? Adding that to the education that you have. If you're at the University of Utah Health, Ruth and I have, connections. We really, really appreciate this connection we have with the health department and the Living Well Coalition across the state, to help us, again, bring that education and kind of bridge the gap between our community resources and our hospital resources. So I definitely want to say we can give you and help if any resources that you need or education. And then again, just open it up again. I see that there's been some conversation in the chat answering questions, but is there anybody else that has any other questions for any of our speakers today? All right. Well, Stephanie, Marianne, Ruth, thank you guys so much for being here. Again, we'll get this recording up on our YouTube playlist. And for everybody else, for contact hours, we will be sending out that Google survey. I should have it out either the end of today or tomorrow. I will get that to everybody to get you a certificate. So thank you again. And if you guys want any of the contacts of any of our speakers, again, you can reach out to me.
Thank you.
Thank you.